From the Skyterra Wellness Retreat, this is the Inspired Intentions Podcast, where we help people build the skills and mindset to live a healthy life. Hey everyone, before we dive into today's episode, if you've been enjoying our podcast, take a moment to rate and review. It may seem like a small thing, but our ratings and reviews make a huge difference in the quality of our show. They help us reach more listeners like you so we can continue bringing you more amazing content. So, if you've found inspiration, learned something new, or just love tuning in every week, please rate the Inspired Intentions Podcast 5 stars and leave us a review and even share with a friend. We truly appreciate each and every one of you. Now let's get into the show.
Hello, Inspired Intentions listeners. We've talked in the past about how it is that we plan out our podcast topics. Alan and I work with a team of 2 other people, Avery and Bobby, and we meet once a week and we talk about what's trending on Google, what we're hearing from guests. And the topic for today, which is plantar fasciitis, is one that Alan suggested. And the reason why he suggested it is he said he was hearing it a lot from guests. And interestingly, I don't think that I have told Alan this yet, although he is always here in the booth off mic, so he's hearing it at the same time that all of our listeners are. Our guest for today is Dr. Becky. Hi, Dr. Becky.
Hey, Rachel. Thanks for having me.
Of course. Thank you for being here. And when I got together with Dr. Becky to plan out this episode about plantar fasciitis, one of the first questions that I asked you was, is this something that you hear from guests? And you said, well, I've heard it from my other patients, but, not necessarily from Skyterra guests, but I think that, I've only been here for a little while and maybe that's why. And then you asked me kind of, where is this coming from? And I said, well, Alan said that he hears it from guests all the time. And you said, oh, that makes so much sense.
Yeah, because Alan is literally our boots on the ground.
Yes.
He works in our outdoor recreation. He is the one who is on the hike with guests. And so 2 miles in, someone's foot starts hurting. And plantar fasciitis, shows itself, right? Typically with prolonged standing or walking. Mm-hmm. That's when it rears its head. And ironically, and I think this is where my mind was when I started talking there, just in the past couple weeks, since you and I first talked about this subject, I have had a couple guests mention this. I have had a friend complain about it, and then a former patient had contacted me about this. So it is alive and well. So I'm glad we're talking about it today.
Oh, wonderful. Okay, well, isn't that funny how that happens where you haven't talked about something for a while and then all of a sudden it seems to be everywhere. So it's relevant. We're going to cover it for you today, listeners. So thanks so much. And of course, thank you always to Alan for bringing the ideas to us.
Yes.
Okay, so first, really the basics of all of this. What is plantar fasciitis?
Okay, well, let's start with the word itself. Plantar basically means in contact with the ground. Fascia is connective tissue, and itis is inflammation. So this is an inflammatory condition of the bottom of your foot, of the tissue that makes basically up the arch of your foot. It often presents as pain around the heel, although it can be throughout the arch, and sometimes it spreads to other parts of the foot as well.
And what I should have done earlier, which I haven't done, is, of course, we've had you on our podcast before. We had you last on talking about dry needling, which was episode 209. But for our listeners who are hearing from you for the first time, could you please reintroduce yourself, Doctor? I was so excited to talk about plantar fasciitis that I jumped right past this. So
Sure.
Yes.
Sure, yeah. I'm Dr. Becky Davidson. I'm a doctor of physical therapy. I'm also board certified in orthopedics. I have been at this a long time, and I always say all of the thousands of people that have come before the person I'm working with right now help me to work with you because you learn something from everyone. And I love the puzzle of the human body. And one of the keys to dealing with a problem like plantar fasciitis is really trying to get to the source of the problem. Once we know the source of the problem, then we can address it and we can cure it.
So when it comes to plantar fasciitis, you mentioned it often feels like pain around the heel, but it doesn't have to be. Does it happen? I have dealt with this in the past, and for me, it was always worse in the morning. Is that a common thing?
That is very typical of this condition. The first few steps in the morning can be absolutely excruciating.
And then kind of lessens as the day goes on.
Typically, but then as the day wears on more, it often gets worse because that's where you've been up on your feet, for a good bit of the day. So we see this pattern: worse in the morning, gets a little bit better as you get going, and then it tends to worsen as activities increase, weight-bearing activities, which means when you're up on your feet. And do you mind sharing, how did that feel to you? What was that pain like in your foot?
I would describe the pain as tight and sharp. And for me, it was definitely induced by running, probably with not a great run technique. A lot of heel striking, I'm guessing. But it was, I would call it probably mild, moderate, or maybe I just have a higher pain threshold. It wasn't terrible. But it felt like it just lingered. It took several months to get rid of.
It can be a really frustrating problem. And with the diagnosis, there's not one special test or an imaging study that is going to make a diagnosis. It's really your clinical presentation and ruling out other things. Oftentimes, the pain is so intense that people fear that they might have a fracture.
Oh, interesting.
And so that is easily ruled out with an X-ray. And people are very surprised at how painful that connective tissue can be. Getting it treated early really helps to prevent it from lingering. The longer you go with an unaddressed orthopedic problem, the longer it typically takes to settle it down.
Okay.
And being a runner, first of all, I'm not surprised that you would have a high pain tolerance because that's just one of those activities you have to be really tough, to get out there and do it day after day. But running is one of those activities that certainly can lead to this. But we often see it in people who are sedentary as well. And there might not be a clear provocation for this condition. But this leads me a little bit into footwear. I just had someone talk to me the other day about having wore some flat shoes, like the little cheapy things that you get at when you go get a pedicure.
Yeah.
Okay. And they're just designed to be worn for a very short time while your nails dry. But they got worn for a longer period of time. That led to some really significant foot pain. And so having supportive footwear can really go a long way to prevent and also improve this condition.
Have you ever had plantar fasciitis?
Oh, I have.
I don't know if I'm allowed to ask you that.
Yeah, that's fine. That's fine. I don't mind a personal question. I can always pass if I did mind it, but no, I don't mind at all. And yes, and I have to say, it made me much more empathetic to the guests that I would see with this, and patients that I've seen with this, and I've seen many over the years. I was shocked at how intense the pain was, and the context of this. I was on a cross-country flight. I was navigating 2 major airports, and I chose, this was not a good idea, but I chose to wear a pair of flats, and I was dressed for this party because I was flying in to Detroit, where my family is from, And I was going to be helping my mom set up a graduation party for my younger brother. So I went from this travel straight into the kitchen for hours and then this event. It was just one of those days,
Long
nonstop.
day. Yeah.
And I knew I wouldn't even have time to change, but I should have wore a pair of athletic shoes, thrown them in my bag, and then just switched into this dressier pair of shoes. I woke up the next morning, first step on the ground, it like put me back in the bed. It just was excruciating. And it took a while for that to settle down, but I knew what had happened. I was hours on my foot, no support whatsoever, and boom. And I had it another time, and it was actually during one of my pregnancies. And during pregnancy, there is a hormone called relaxin that is secreted by the ovaries and placenta. This helps prepare the female body to give birth. But it doesn't just relax the ligaments in the pelvis. It relaxes tissues all over our body. And think of that plantar fascia that we talked about at the beginning. It provides that support for the arch of our foot. And so it causes a bit of a stretching there too. So this is also, even though the chances of getting this increases as we get older, a pregnancy is kind of a special circumstance where we can see this quite a bit. So yeah, I've had it twice and I hope I never have it again. Thankfully, I'm a PT. I always say if I wasn't a PT, I'd have to go to one all the time because if you're active, things are going to come up. They're going to come up that hurt, and you want to have them addressed.
Is footwear then, would you say footwear is the way to prevent plantar fasciitis?
It helps. Unfortunately, there's not anything that we can say is 100% going to prevent this. But in general, wearing supportive footwear with an arch support and with a positive heel rise will really help, okay? And listeners, you might wonder, what in the world is a positive heel rise? This is as opposed to a negative heel rise. And that means the back of your shoe should be higher than the front of your shoe. And there is kind of a trend in barefoot this and barefoot that, and like the old earth shoe. Those things tend to have that negative heel rise. That can be a precipitating factor for plantar fasciitis.
What is it about that negative heel rise that can aggravate this?
It just puts more of a continual stretch on these tissues, and then they start to talk back.
Okay. And, we've touched on this barefoot movement on this podcast in the past and in the course of planning out this episode. But, we hear all the time of humans were meant to live naturally, and this is the way that we lived thousands of years ago. But tell me what you think about that.
Well,
what about this barefoot
movement?
A
few things. The first thing I'm thinking about is having a refrigerator and how grateful I am to have one. Humans didn't have those thousands of years ago. So, you can kind of extrapolate that idea to a lot of things. And, back in the day, there wasn't concrete.
Yeah.
There wasn't asphalt, tile floors, hardwood floors. We do not live and function in that natural environment. So we need to accommodate for it.
Yeah.
And, every so often, and I like going barefoot. Don't get me wrong. I do go barefoot sometimes, but I am not going to run barefoot. I'm not going to walk, a mile in bare feet. And, you might reminisce about, oh, well, when I was a kid, I was running barefoot all over the neighborhood. Well, first of all, you were a lot younger. And secondly, you didn't do that all at one time.
Yeah.
Your body built up a tolerance to that. As a doctor of physical therapy, measuring risk benefit, I see and believe, and the evidence shows, there is far more risk than benefit to jumping on the barefoot movement train.
Okay.
But hey, I'm all about if you want to, go out in the morning and ground yourself
Yeah.
in your backyard, get your feet in the grass, um, you know, say, lift up your heart in gratitude. I'm all for those sort of situations as far as getting closer to our amazing earth that I love and care for. But, please don't run around the block. Like, just go back inside and put your supportive shoes on.
Yeah. Okay. So supportive shoes, supportive athletic footwear are very, very important. I heard you say, but I just want to make sure I'm sure. Do we know what causes plantar fasciitis? Is it caused by, you mentioned your pregnancy. Is it caused by any one specific thing?
Well, in individuals, it could be. It could simply, everything in their life might be the same, except for, okay, you are pregnant, or you wore this different pair of shoes, or you didn't wear shoes, or you were at a conference for work and you stood 12 hours, whereas normally you're at your computer sitting a good bit of the day. But generally, it's generally multifactorial, which means, more than one thing usually causes an orthopedic problem like this. So a lot of the treatment, this is kind of I'm going to segue into treatment. I want to make sure we
Please,
have time to
yes.
talk about this. But education is a huge part of people getting over this and knowing what to do about it. So we always address footwear, also address activity. Let's say I'm working with somebody who's in the hospitality industry, and their job might keep them on their feet for very, very long hours. And we might talk about the benefit of just sitting, even if it's for 30 seconds, every hour. That can go a really long way to helping someone get over this very tough condition. I certainly do not advocate just getting totally off your feet. We want what I call active rest during recovery time. And there are certain things in that PT tools, if you will, that can really help. A thorough evaluation goes a long way in identifying problems. The source for some people is tightness in their calves. Okay. So like with runners, it might not just be the impact of the foot on the ground, but if you've got a really tight calf that's pulling your foot into a plantar flex position, you can imagine like a ballerina position, like if you point your toes, okay? When your calf muscles are tight, that's the direction that your foot goes. That shortens that fascial tissue on the bottom of your foot. Okay.
Yeah.
Then when you take those first steps, it's a sudden stretch and ouch.
Yeah.
So proper exercise prescription matters. I'm often prescribing exercises that I want a person to do even before their foot hits the ground in the morning. Okay. That can make a big difference. Also, in a treatment session, might do dry needling for the calf area or the foot, hands-on work, soft tissue mobilization, deep tissue mobilization, cross-fiber tissue mobilization. This is really getting into that foot and calf area with the hands. And I'm always looking up the entire kinematic chain. You have to think about a person's knee positioning, their function, and what's going on at their hip and low back. So all of these things matter. And then there's modalities we use, things like ultrasound, e-stim, cold laser. All of these things can help move a person forward and get over this. It's not going to last forever.
Yeah.
Like you will get through this, but it's a really challenging problem. But know that you can set yourself up to minimize the chances of getting this. And now I hope you have a little bit of an idea of what to do if you do get plantar fasciitis. I think I actually pronounced it right this time. I was really fumbling at the beginning. Where's the coffee, Alan? We need to get some going here. But does that help? I hope that makes it a lot clearer for you.
I have a question for you, Dr. Becky. So we have guests here at Skyterra who are here for as little as 1 week. Is there work that could be done in a 1 week period, or is this more of an extended treatment plan if someone has this?
Okay, great question. And it depends.
Of course.
Of course, it depends on how long a person has had this. If someone is saying, oh, yeah, for the last 6 months, I've been having this terrible heel pain and foot pain, and it's worse in the morning. And, we conclude that, yes, this is a case of plantar fasciitis. That's going to take longer to resolve than someone who, say, they're being a lot more active than usual. Like they may be coming to our beautiful wellness center for a reset, right? On getting back up to speed with exercise. I hear this so often. People, for whatever life circumstances they're dealing with, have been put in a position where they weren't able to care for themselves properly. And so they're coming for a real reset on their physical activity. Well, going from sitting most of the day to hiking and going to 3 classes and things like that. If this just flared up yesterday, well, yeah, we can get this settled down really quickly. Maybe just one session can make a huge difference.
Yeah.
But again, that is very individual. And also it's getting to the source of the problem. And know that, other things can mimic this problem as well. So it's important to make sure you're really dealing with the right diagnosis, basically.
Sure. So we've talked about footwear. We've talked about education, kind of pacing activity correctly. Is there anything else that you can do if you feel like this is flaring up for you, if you've dealt with it before in the past or not, that you can work on to help?
Yes. One thing comes to mind immediately. Check your covers. And I'm talking about your bed covers. Okay. And this is one of the theories behind the onset of this, especially in folks who can't really identify a change of activity. And all of a sudden it's like, why is this happening to me? What's going on? Well, at night, if you've got heavy bed covers or they're tucked in really tight, remember I mentioned that ballerina position of the foot? Okay, your foot's not going to go the opposite way. It's going to tend to point down. And so if you're in that position for hours and hours while you are sleeping, that plantar fascial tissue, it tightens up. It gets shorter in that position. Then when you get up and start walking, all of a sudden it's got this sudden stretch. You went from one extreme to the other. So think about those covers. And, I'm all for weighted blankets, right? There's a lot of good evidence that weighted blankets will help with anxiety and improving sleep. But they're pretty heavy. That may be an extra, 17 pounds or whatever spread out over you. And that really is going to push the feet down. So in a case like that, get some heavy socks. You can still use a weighted blanket, but don't put it over your feet.
Okay. Let your feet free.
Yeah, let your feet be free.
What about night splints? That's one that I use that seemed to help anecdotally for me.
Okay, all right. Well, good point about the night splints. I hadn't mentioned that before. And how long did you use yours for approximately?
Probably 2 months.
Okay. And I'm very familiar with night splints, but since you were the one dealing with this, do you mind describing to our audience what is a night splint in this case?
Yes. Okay. So it's very attractive, listeners. It is a white knee sock that has a strap that goes from the top of your foot up to the top of the sock near the knee. So it holds your foot in a flex position. It's lovely.
Yes, and they do come in black as well, just so our audience understands that, okay? Yeah, and what this is, it's putting your foot in what we call a dorsiflexed position. Plantar flexed is when the toes point towards the ground. We talked about, plantar has to do with the ground. So what a night splint does, it puts your foot in that opposite position. So that way, this fibrous arch is lengthened during sleep. So when you are up and about the next day, you're not getting those sudden stretches. And a night splint is another tool, like in the toolbox for treating this. And many people find that they are helpful. Some people find that they are not tolerable, that they just can't get to sleep with it on. Did you have any trouble falling asleep with it on?
No, but
okay, good.
I could understand how somebody might.
Yeah. So it's like mixed results, but I certainly think it's worth trying.
Mm-hmm.
And they are now readily available you can just order them online.
Mm-hmm.
And so that's great. Back in the day you had to go through a medical supply company. So they're much more accessible right now and can be a really great tool to help with this. And note, they are not designed to be worn during the day. I have gotten many questions over the years. Okay, well, this seems to be helping. So should I put it on a couple hours, during the day and prop my foot up? And I'm going to refer back to the term I used before, active rest. Even though your foot might be hurting an awful lot, it might hurt to stand and walk, you absolutely don't want to put yourself in the bed or the couch over this. We know that's counterproductive. We want better blood flow to this tissue. We want that arch getting moved. And you can't consciously contract or relax your plantar fascial tissue. It's not like a muscle. Okay, it's just there. So that's where it's so important to set up the environment and your positioning for that. And during the day, we want your foot moving. We want your leg moving, because that's going to help increase the blood flow to that area. An area that's getting a better blood supply is definitely going to heal faster than not. So that's the downside of any sort of splinting or immobilization, is that you're not moving. You're not moving. But thankfully, these night splints, they're of a softer material. It's not like a hard cast or anything like that. But thank you for describing that to us, because you had firsthand, you slept with it. You actually slept with it. So,
Dr. Becky, thank you so much. Is there anything about plantar fasciitis that we haven't covered?
Okay, let me think. I think we've hit pretty much the high points. I think, the big thing is to really think about your footwear, and know that it is a little different for everyone. And there's a big emphasis on arch support, but when you are in the acute stages of plantar fasciitis, a thick arch support can actually be more uncomfortable for you. So don't force it. If that footwear doesn't feel good, set that aside and go for what does feel good. This is not a condition that you can just tough through.
Okay.
And like feeling the pain is not making it better. It's actually making it worse. And so you might just do better with even interestingly, some people find that a dress shoe in the acute stages actually feels better.
Oh, interesting.
Yeah, it is very interesting, but it can actually feel better than their normal athletic shoe because you're not getting that pushing right where that attachment is near the heel.
Okay.
Okay. And this leads me to another point that I do want to make before we sign off. Okay. So number one, be flexible about your footwear. And I don't recommend any specific brand of anything. It's very individual. I always say try before you buy, before, really wear your footwear before you take the tags off or throw the box away or whatever, wear it around the house. Or if you're out at a store, put on those shoes and walk around and carry the one shoe came in with just to make sure that it does feel good. If shoes do not feel good right away, they are not going to feel good. Do not think you're going to break in a pair of shoes.
Well, that's helpful.
They should feel good right away.
Okay.
But, appreciate the point that you might feel better and it might be more therapeutic for you to wear, like I said, more of a dress shoe or a shoe with like a little heel on it as you're getting over plantar fasciitis. Okay. So that's a big one right there. And I'm trying to think, did we cover everything?
I think we did.
I think we mostly covered everything.
Yeah.
So
this has been excellent
well,
and so helpful.
Well, thank you for allowing me to share, and good luck, everybody, with your feet.
Yes.
If your feet don't feel good, you're not going to feel good.
Yeah. That's very true.
Yeah. But this is a manageable problem. I'm when people come to see me about this, I'm very confident that we can move you forward and get you past this.
Thank you so much, Dr. Becky.
All right, you're welcome. Thanks for having me.
And listeners, if you are looking for more information from Dr. Becky, as I mentioned, we had her on our podcast earlier, Dry Needling, episode 209, or more importantly, come to Skyterra. Get a chance to see her as well. Well, Dr. Becky, thank you again for your knowledge and your expertise and just how much you care about all of us. It's a gift.
Well, thank you.
Thanks, everybody. Bye.
Bye-bye.
The Inspired Intentions podcast is a production of Skyterra Wellness Retreat. Special thanks to our executive producer, Alan Broyhill. Send us your questions and comments to inspiredintentions@skyterrawellness.com. Subscribe on iTunes and everywhere podcasts can be found. If someone you know might benefit from this podcast, share Inspired Intentions with them and give us a 5-star rating. Join us next week as we cut through the unrealistic noise on diets and fitness and show you how healthy living fits seamlessly into your already busy life. Thanks for listening.